Welcome to the second trimester of pregnancy. By now, you should be starting to feel better. The nausea and vomiting most typically will have gone away, and your energy levels will have returned. There's a little bit of a honeymoon period between about 13 weeks and 24 weeks where the risk of complications is at its lowest point. There are important things that your obstetrician is going to talk to you about nonetheless. The first is your next ultrasound scan, typically done around 18 to 20 weeks. We call this the morphology scan. Critically important. It's a full structural assessment of baby to make sure that the brain, the heart, the lungs, the tummy organs, and so forth are all developing normally. The position of your placenta will be checked, a critical thing for us to know leading into delivery. They'll have a look at the length of your cervix. Also important to gauge your risk for preterm delivery. Every now and again we do find concerns which again we can address. Here at Pindara, one of the things that most of our obstetricians will talk to you about is our midwifery program called Know Your Midwife. Particularly for first-time mums, an invaluable service that the hospital provides that links you into a continuity of midwifery care model that sits side by side with the care offered by your obstetrician. I find from my own patients this is an invaluable service in terms of not just mothercrafting and breastfeeding support, but also preparation for labor and delivery. Towards the end of the second trimester, typically around about 26 weeks or so, your obstetrician will advise you to have two things, both done as blood tests, an anemia screen, and secondly, your glucose tolerance test. This is a screen for gestational diabetes, something that I recommend to all of my pregnant patients, regardless of their health profile. Diabetes doesn't discriminate in pregnancy, and it's important that we know about this critical complication of some pregnancies so that we can manage it appropriately.